Welcome, everybody. I really appreciate your being here and joining me to talk about what I think is a very important issue for all of us that are involved in care and caregiving, which is really trying to understand other people and their needs, and in order to meet those needs. And specifically, I want to talk about situations that we often encounter when caring for people with dementia or Alzheimer's and other forms of dementia. So let's talk about some other cases here, and I think I'm just going to focus on the problem solving, and the text that I'm going to show you can read at your leisure. But here's an example. This is a patient of mine who has Alzheimer's, and she was in one facility that she ultimately was, shall we say, involuntarily discharged from. This was after several psychiatric hospitalizations and attempts to use medicine, which were ultimately unsuccessful, as they usually are. And one of the big things that was a problem for this facility was that she would wander into other people's rooms on a regular basis, and she would often fight with them, particularly over a baby doll. There were a couple of baby dolls there, and now let me ask you this: how many of you get home from work, say, I'm going to play with dolls? Okay. How many of you play with dolls at work? Okay. Many of you used to, but it's not something you do every day now. How many of you think, I can't wait till I retire and I can play with dolls again? Okay? Is that what this is really about? Does she think it's a doll? I mean, she feeds it. Okay? She puts food in its mouth. She thinks it's a child. She thinks it's her child. Can you imagine the distress that a mother would experience if their child was missing? Or if they saw someone else take their child? So then you can easily understand this reflexive behavior that's going to be elicited in these kind of situations. Now, if you work in a hospital or a nursing facility, let's talk about you for a moment. Have you ever made the mistake of of going into another patient's room than the one you were looking for? Have you ever done that? Have you ever started talking to the wrong person? Maybe even examining them? What's wrong with you? Why did you do that? Why did you go into the wrong room? I can tell you why I do it. I don't do it on purpose. But let's face it, in most of these settings, they all look alike. The rooms look very, very similar. I've gone to hotels and put my key in the wrong door. I've even gone to the wrong hotel and put my key in what I thought was the right door. Okay? So, anyway, it's easy to understand what the behavior is, even though it may be distressing to other people. By and large, people who wander, they often don't appear to be in a great deal of distress themselves. Okay? Let's talk about that. What is wandering? And what's wrong with it? Why do they do that? And again, the first question is, are they in distress or not? Very often the answer is no, although some people, occasionally you'll find somebody who feels like they have to be somewhere else to take care of somebody and they're looking for a way out. I'll ask you this. Well, for the sake, just to lend a veneer of credibility to what I'm trying to say, I'll just make the statement that wandering can be defined as moving about in, and I'll say, an apparently aimless or disoriented manner. I say that because I wander all the time, and I know, and I'm not aimless or disoriented, I just don't always care where I'm going, okay, all right? How many of you have ever wandered? I'm not talking about your marriage here, I'm just asking you, how many of you have ever wandered around, okay? For many people, it's a healthy coping mechanism. We like to move, if you have stiff legs from sitting for a long time, it feels good to move, okay? If you have arthritic limbs, it may be critically important to keep moving. I wandered around when I was lost, but didn't want to ask directions, okay? Or maybe was bored and just wanted to check things out, or was curious, okay? Sometimes it's a need to exit a stressful situation. Sometimes it's a search for something familiar, maybe a need to go to the bathroom. So you can see the same behavior can have multiple meanings, okay? And our task is to figure out, in this particular instance, in this particular person, What are they telling us so we can help meet that need? Okay? We just talked about that. But sometimes, though, ironically, what we perceive as wandering can actually be a side effect of some medications that can make people feel restless. Okay? So keep that in mind. I didn't tell you what happened to the other woman. We'll come back to her in a moment. Here's a situation of another patient of mine from many years ago. This woman lived in a nursing facility, and she was very healthy from the standpoint of her ability to move around and even take care of herself, but she had dementia, and she needed supervision, and she needed a very little bit of support in doing particular tasks. But this was a 3-story building, and she could actually go to the elevator and go downstairs to the dining room and come back up and find her room and so forth. She was just a lovely, delightful person until she pulled the fire alarm. Okay? At first, they didn't know it was her, but this kept happening, and they saw her do it. Okay? They saw her pull the fire alarm. And the fire department didn't appreciate it very much, was threatening the facility with fines. The facility was feeling helpless and frustrated, and they, tried everything, including every medicine you can think of. And it got to the point where this behavior kept continuing that this woman's family was actually told that we're going to have to find another place for her. Okay? And actually there was this big meeting of the minds where everybody tried to get together to figure out what was going on. And the director of nursing actually said, as they had made the decision just a moment earlier, that we love her, but she has to live somewhere else. The director of nursing had actually said, as she was getting ready to walk out of the room, what a lovely person. It's such a shame if only she hadn't pulled the fire alarm. Well, a nursing assistant who was sitting there made the comment, well, it does say pull on it, okay? And in fact, not only does it say pull, but it says pull in big letters, okay? What it says in very small letters is, in case of emergency, pull, okay? Well, she was walking down the hall toward the elevator. She'd see this thing on the wall, look at it, pull it, keep on going, okay? She thought she was doing her good deed. There was no ill intent. She didn't try to, she's not in middle school or anything like that. In her mind, she didn't do anything wrong. In fact, she did everything right. So there was a stimulus that she responded to. So now that you know why she pulled the fire alarm, how do you fix that? It's easy, right? We've got to modify the environment. Okay. And there are lots of ways that can be done. I mean, there can be a cover over it and so forth. They couldn't actually move the fire alarm. That was a little tricky. And this was a rural area, and we were not blessed with excess of resources, but someone had the clever idea to put a little sign up, basically just a piece of paper in big bold letters that said, right above the fire alarm, it said, "Not you, Ethel." Okay, all right? So she would walk by, she would see the sign, oh, okay, and she'd keep on going, okay? So, again, the environment caused that response. You had to modify the environment to get a different response, okay? And again, these behaviors, regardless of the outcome, the intent isn't bad, okay? This was a lovely, kind woman, okay? She didn't suddenly become a delinquent, okay? She was still a lovely, kind woman who was trying to function in an environment that was somewhat unfamiliar. All right, this fellow was in the hospital. He had heart failure and was hospitalized with shortness of breath and was treated with medicines. And he was confused, and everything that could be done to try to ensure his safety, in other words, usual care, was provided. And that included having a bed alarm and having a chair alarm in the event that he tried to get up. And this gentleman would get up frequently during the night and try to get out of bed. Okay, of course there were rails on the bed, and he was even seen trying to climb over the rails. And every time the hospital staff, when they heard the alarm go off, would run in there and they would say, "It's nighttime, you're supposed to be sleeping, lie back down and go to sleep. And every time this happened, he got more and more upset, shall we say agitated, okay? Why would he do that? Well, let me ask you a couple of other questions. Why would any 82-year-old man get up during the night? Typically, they have to urinate at least once. Someone who's hospitalized with heart failure is on medicines that makes them urinate even more. So this is not only normal behavior, it's expected behavior. It is the natural consequence of the treatment and the reason why he's in the hospital in the first place. And what was going on here was he had a need that people didn't understand and that they didn't try to meet. But it was a need that must be met, okay? And he did not want to urinate on himself in bed, and he should not, okay? So this is a simple case of trying to, of the importance of trying to anticipate basic needs, and simply putting yourself in that person's situation is often enough to figure that out. By the way, these alarms, even though they're used all over the place, they often cause a lot of distress. They're noisy. By the time the alarm goes off, if someone may actually be on the floor. So they don't do what we'd like them to do. And that's another story. But I guess what I would just say about that is that, first of all, we must never, as human beings, we must never expect more from technology than we expect from ourselves. Okay. Second, you're the solution, not the problem. Don't be the problem. And what this man needed was you. Okay? Not an alarm, not anything else, not even your words, your presence and your help. Okay? And you all can do that. All right. So let's talk about agitation for a moment. That's what this gentleman, that's the medical term we use for this. Although, and if you're not a healthcare worker, you probably don't use that word in your vocabulary. You probably use instead something that describes how you feel, not how you look. Okay? Instead of saying I feel agitated, you might say I'm worried. Okay? Or whatever it is, or I'm in pain, or I have to go to the bathroom. But in the medical world, we've tended to come up with this and other labels. And to keep in mind, it's just a sign of something, and we have to figure out what that is. But it often results in other responsive behaviors. Okay? And it could represent anxiety. It typically represents emotions. Okay? And we want to try to figure out what people are feeling. Sometimes it's frustration or boredom. Sometimes it's pain. And if people are agitated and there doesn't appear to be any sort of rhyme or reason to it, in other words, it's not episodic, it's not in response to something, then you really need to think about, is this person in pain? That a persistent problem? Or are they depressed and anxious? You know, and it may also be that they're constipated, or they have to go to the bathroom, or any number of other things. So all of these things are another person's way of saying, I need something, okay? But I can't tell you what it is with words. All right. So let's go back to this woman who was basically kicked out of one facility for her behavior. She fought with other people over this baby doll. Well, it turned out when I met her daughter that she had terrible arthritis of her hips, and in fact, almost 10 years ago, a surgeon had recommended that she have a hip replacement. But her dementia got worse, and basically that other concerns sort of took precedence, and so she never had that done. But she still had a bad hip that was often quite painful. Okay, and in her case, one of the things that proved to be very helpful was simply giving her Tylenol, and also she liked to get up and move around, was to walk with her. Say, hey, let's go for a walk. And instead of responding to every time she was on the move, individual caregivers could actually schedule that and have some control over that, so that they could match up care resources with care needs. Okay. And as I mentioned earlier, it's important to try to distinguish underlying illness from environmental causes, especially if the agitation seems to be persistent and ongoing and really, if you will, refractory to other things, okay, versus something that's situational. And again, what happened? Who was there? What did they do? And what happened as a result? Oftentimes it's the response of others that causes or makes agitation worse, and that's very helpful to know. Now, when I in a situation with somebody who's quite agitated, first of all, in a healthcare setting, whenever there's a problem, we tend to all flock toward it, okay? And actually, if you see all these people running down the hall, it's kind of scary, okay? And imagine being the one they're running at, okay? So the first thing I recommend in these kind of situations is everybody just take a step back. Actually leave the room for a moment, okay? Let's see if things will calm down on their own. I use that as a diagnostic test, if nothing else, because then I know, okay, this was a situational thing that was brought on. Whatever we just did, we're not, that caused this, we're not going to do that anymore, okay? And in addition to that, when it gets better, you give everybody confidence. You see, this isn't permanent. This is something we can control. Plus, it's hard to think when there's a lot of commotion going on, so everybody just kind of needs to calm down. All right, we talked about wandering, and I just want to emphasize some other approaches that you can read, but keep in mind that movement is normal and good. We have to facilitate appropriate physical activity at the same time as trying to keep people safe. So just simply trying to keep people safe by saying you can't move, that just simply isn't good enough, okay? We have to help people move in a safe place, in a safe way. If the issue is that people are having trouble finding their way, like finding their way back to their room, we have to help them, and we can modify the environment to do that. How about a picture of them by their room? But don't make it a picture from today, because as this condition worsens, they get younger and younger. What's the picture of my dad doing there, okay? How about a picture of them when they were younger? That's something they might recognize as them. In addition to that, how about a younger picture that shows this person as a vibrant, vital human being, okay, that helps us to relate to that person as someone like us instead of an older person with dementia, or worse, just dementia. And there's some other things that can be done, with regard to doors to kind of disguise them so that people don't. Because if you see a door, and you're curious, you may want to know what's on the other side of that door. It may be a stimulus that you're trying to respond to. Even just moving a door handle higher up, it can often have a big impact. A stop sign, where if you don't want people to go there, these are things. It's easy, it's cheap, okay. And then some other things that I mention here: accommodation, substitution, distraction, and redirection. Let's talk about what that is. Well, accommodation is basically going along, okay? Oh, you want to walk? Okay, let's walk. Mind if I walk with you? Okay. Substitution would be offering something else instead. Instead of saying no, you can't walk, no, you can't go through that door. Oh, would you mind doing, how about we do this together first, okay? Distraction would be maybe taking people's mind off that, getting their attention elsewhere, and maybe steering them in another direction. And redirection really is more like steering. It's not the same. I mean, when you hear people talk about this person, I couldn't redirect them, very often when you ask a person, well, what do you mean by redirection? They often say that they mean, in so many words, I told them they were wrong and they wouldn't believe me. Okay, they're trying to reorient them, which doesn't work in people who are disoriented because of their illness. Okay, here's a situation that it was a facility that prided itself on dementia care. They had a 60-bed dementia unit, and they were all women on this unit, just coincidentally. Okay, and they were, quote, always fighting with one another. Okay, always agitated. Now, that wasn't really true. I mean, they slept sometimes. They weren't fighting in their sleep. They weren't agitating in their sleep. But that was the perception, that was the reputation that these folks had. Well, there's a little more to the story. Yes, it was a 60-bed dementia unit, and yes, there were 60 women that lived there who all had dementia. But there were a few other residents. There were 3 baby dolls. 3 and only 3, okay? Now you see why they were agitated and always fighting. They were fighting for their children, okay? The solution was someone went across the street to Target and bought 150 baby dolls, okay? Suddenly everybody had a doll, and when their doll got lost, another one would quickly replace it. So don't, all right. We sort of talked about this, but I just want to emphasize that there's this tendency to blame the person who exhibits the so-called bad behavior, and just keep in mind that not only is it highly judgmental, but when you do that, suddenly the person that you're supposed to love and care about becomes the enemy, okay? And they're not your enemy. Don't be their enemy. It also mistakenly assumes they're doing it on purpose when obviously they can't help it. If they could help it, they wouldn't be in this fix in the first place. And more than anything else, it just doesn't work. Okay, it's counterproductive, and it results in a reactive approach where that's always too late. Okay, and it becomes a vicious cycle where this reactive behavior elicits a reactive behavior, and so on and so forth. And the fact of the matter is, 60 women, they can't all be bad, can they? Okay, so overall, these are people who've been successful at living. They've all lived longer than I have. They're good at it. Okay. I want to help them to continue to be successful, and so do you. We want to use the abilities that remain and focus on what they're able to do, not what they can't do. Okay? We want to give people important things to do that they're able to do that they can relate to. Someone who is a mechanic, we may not have them fix our car in the parking lot, but they might enjoy handling things, maybe parts or tools or so forth. They might enjoy pictures of the cars and so forth. You might be able to engage them in stories about their work as a result in response to that kind of a stimulus. Okay, and there's not one particular thing for each person because everybody's different, everybody's unique, and everybody deserves a unique approach. Okay. What your sister likes isn't always what you like, okay? So we want to try to individualize these things for people. And this is something, that can and should be accessible at all hours. A magazine, do you have to lock that up? So music can be very, very important to people's lives and therefore very helpful in these kind of situations. Art and other ways to express oneself. All right. I want to just go over a couple more cases. I know I'm taking way too much of your time, but just to show you that you're good at this, okay? Here's a woman who lived, she had Alzheimer's. She had moved recently to an assisted living facility, and the staff called to ask for a medicine to control her behavior. And they described the behavior she was always agitated and resisting care, that she would hit caregivers, and they volunteered that, as if to say this was so bad that she really needed the medicine, that she would wander into other people's rooms and steal their clothes, okay? And in fact, she would hide her clothes, okay? Often soiled clothes. And when the staff would bring her her clean laundry, she would say, "Those aren't my clothes. Someone stole my clothes," okay? And she accused the residents and staff of stealing from her. So what is it about clothes? In this case, obviously there's a theme here. Well, as it turns out, her daughter reported that this woman, she lived on a farm with her husband. They raised their children there. Her husband essentially ran the farm outside of the house, and she ran the house. And her whole adult life, she did the laundry, nobody else. And she always did the laundry on Saturday. Okay. And in talking to the staff, what they did is that when she was sleeping, they would take her clothes. They would steal them, okay? But they would bring them back. They would steal them and they would wash them, and they would bring them back. But when they tried to explain to her that they'd washed her clothes, that was completely incomprehensible to her. It's something she couldn't relate to because she had never experienced it before. And so now the solution becomes obvious. Why can't she be involved in washing the clothes? At a minimum, can't they ask her to gather up the clothes, tell her it's Saturday and it's time to do the wash and they'd like to help her? And then she can see the wash go into the machine and she can see it come out. Why can't we give her that? Similarly, do we have to make such a big issue about it? Maybe we could how often does she have to change? Does she have to wear different clothes every day, or even different looking clothes every day? So let's not make it more complicated than it has to be. But here's an opportunity to give somebody a feeling of success and give her old job back, even in a symbolic way. They actually did that for a while, and what happened, it worked very well. And after a while, she sort of lost interest in it. At the same time, she didn't complain that people were stealing her clothes. So like everything else, these things get better on their own. We grow out of it. Here is a difficult situation because this is a nurse, okay? And this nurse, I knew and actually worked with her for many, many years before this happened. In fact, the curious thing was, and I believe this to be the case, that one day I saw her at the hospital where she was a supervisor, and the next week I saw her in a nursing home where she was a resident, okay? And it turned out that that's kind of exactly what happened. She lived alone, she'd never married, she was sort of struggling with some memory problems that became apparent at work, and folks took it upon themselves to get her help and found her placement right away. And this was a 3-story facility, and you would think, being a nurse, she would be perfect, right? She would understand everything, and she would just go along with things, right? But she has dementia, okay? And she doesn't understand where she is. And here's what she was doing. She could walk around. She was said to be frequently agitated, often fighting with other residents. She would take residents who were in the day room, she'd start pushing their wheelchairs, and they'd say, "Stop that!" And she'd keep going, and they would start hitting her, and the next thing you know, she would actually put people in the elevator, push the button for another floor, and let them go, okay? She was, quote, unable to redirect, okay? Now, in the grand scheme of things, pushing other people in wheelchairs, trying to get people where they need to go, what was she doing? She was working. She was being a nurse. What was the environment telling her? In fact, this place, when it was built, intentionally they said, let's make it look like a hospital so people will know it's a good place, okay? So there she was in a workplace. So what are we going to do? Are we going to stop her from being a nurse? Could we stop her from being a nurse? I don't think so. So the only alternative is we got to give her a job, okay? And that's exactly what they did. So she starts working on the floor in ways that aren't so helpful. They say, "Hey, nurse, Betty, come on over here. It's time to give report. Time to make rounds." Give her a clipboard, they get her over to the med card and so forth, give her some tasks to do. She wasn't actually administering medicines or anything like that, but they're basically saying, you're a nurse, that's important, you're one of us, you belong here, we need your help, okay? That was way more meaningful and way more effective than saying, stop that, stop being who you are, okay? Now, and we've already talked about what this is about redirection versus reorientation, but redirection isn't telling people to knock it off. It's pointing them in a different direction and helping them get there. Okay. I'll leave this for you to read, but fundamentally, one of the themes here in a healthcare setting is to try to focus on things systematically and look at processes of care rather than just winging it all the time. We want to make sure that everybody has all the resources they need to know what to do and when to do it, and so forth, and what not to do. And I'll skip over this, but I'll give you a chance to read this over at your leisure, okay? And ways for you to help other caregivers, whether you're a family member, whether you're paid staff, whether you're a doctor or nurse. And then these are just some specific things that people in healthcare settings can do to help not only comply with regulations, but to help communicate with one another, to help plan ahead for success. Okay. I've taken a lot of your time. I'm just going to quickly go over a couple of other things really quick. But here's a guy. He had been a farmer his whole life, and he was urinating on the plants inside the facility. He would also urinate in a trash can. Sometimes he'd urinate on the floor. Now, and many people found this offensive. In fact, they specifically said, he's desecrating our plants. Well, I've only got one X chromosome, so I have to say, whenever a man aims for a round object to urinate in and actually makes it in there, he gets at least partial credit, because you all know how difficult that is, okay? But, and I'll ask you from a medical standpoint, is he incontinent? Well, no. He knows he's got to go. He tries to find a place which he thinks is appropriate, and he goes, okay? But the problem is, he doesn't comprehend his environment. As a farmer, I'm sure he's urinated outside many times, okay? Urinating on a tree may be the socially acceptable thing to do, okay? The fact that the tree's indoors is of secondary consequence, okay? All right, so, but how are we going to change this? Well, one thing we might try to do is anticipate his need. So that, I mean, we know he's going to have to urinate often. Why don't we help him get to the right place when we think it's going to be the right time? Why don't we put him on a toileting program, okay? But this whole notion of inappropriate behavior, people who have dementia lose the ability to comprehend some of these social norms, okay? People often become disinhibited, okay? And that's not always a bad thing. There's so many things that hold us back sometimes that would even be good for us, that would make us feel better, that would make other people feel better. All right, but, and we don't want to be so concerned about the building and not messing up the building that we're more concerned about the building than the people who live there, okay? After all, we want it to be a home, and home is where they love you. Okay, so so I'm going to jump to the end here. I apologize for all these slides that I'm skipping over. You can look at them a little bit later at your convenience. I guess I want to finish with one case that is sort of the exception that proves the rule, and then we'll summarize. And the other cases, I invite you to look at your convenience, and I'm confident that you'll have some insights and you'll solve the problem. Here's a fellow. He was a physician who retired, and it happened that the place that he worked, the same campus, had a nursing facility where he lived, okay? And he was a gynecologist throughout his career, and a very successful one. And this gentleman, very productive in his career, I might add, would wander into other residents' rooms, typically women, since he was one of the few men that lived there, in fact, all women. And he was found by staff on numerous occasions undressing and appearing to fondle several female residents against their will, okay? Now, first of all, this could be a horrible situation where, you know, I mean, I don't want to minimize in any way the possibility of a sexual predator or anything like that, okay? These are vulnerable people that we have an obligation to keep safe. This was a gynecologist who was working in a place that looked a lot like a hospital, and like the hospital, he was making rounds, and he was going room to room, doing exactly the same behavior that he'd been able to do practically in his sleep for 40 or more years, okay? Now, contrast him with the nurse, our nurse colleague, where we said, she's once a nurse, always a nurse, we need to give her a job. Once a gynecologist, always a gynecologist? That's a little tougher, okay? In this particular case, it also turned out that even though they would call every other resident by their first name, they called him doctor. Okay, so they were constantly reminding him that he was the doctor there. And asking the staff what was going on, well, many of them would say, you know, he sort of, often this happens when there's not much going on, he kind of gets this look, this very purposeful look, and he starts at one end and he kind of goes down the hall. And so they were able to identify situations, they were sort of able to anticipate this and steer him a different direction and give him something else to do. So distraction, the redirection we talked about, substitution, those things were ultimately what was successful here. And eventually he retired. He forgot all about it. Retired for real this time. And they didn't have to tell him no. Okay. So again, every case is different. What works the majority of the time, there's always a situation where that doesn't seem to work. But I've asked you the question: what think about what your role is and how you can help. Your role may not be to have the answer to every problem, okay? In fact, you can't. But your role may be to help people see things in a different way, to provide the support and encouragement that frustrated staff may be experiencing, and help to reframe things in such a way that they can perhaps see things differently. So let me just summarize by saying that, you know, behavior is communication. And obviously I'm focusing on behavior that people often exhibit with dementia, but I assure you, well, I'd like to assure you that I don't have dementia, and you can judge for yourself, but I assure you that what I just talked about applies equally to my behavior as it does to my patients, okay? Look and listen to what you are telling other people, okay, without words. Be aware of that. Be mindful of that. Be especially conscious of what people are telling you without words. Search for meaning. Look for the precipitants of that. As much as possible, we want to try to fix or modify the underlying precipitants, which often is the environment, and it's often the people in the environment. So we often need to change to meet the needs of others who can't change. We want to try to demedicalize these situations. Did I say once that this is a situation where you have to do a blood test, where we have to use a medicine? You didn't need to go to nursing school. You didn't need to go to medical school. You didn't need to go to college to be excellent at this. In fact, all of your experiences beyond that only made it worse, only confused the matter, okay? But it's important that we adjust our own expectations and our own attitudes toward the situation, okay? So that we don't create frustration in ourselves when in fact we're actually being successful. It just doesn't feel like it. It's hard to feel like you're doing a good job when it seems like things are getting worse. But being there, sharing life's journey, that's what matters more than anything. And there's always help around. Get help from the experts, family members, nursing assistants, other staff, housekeepers, people in the dining room. These are the experts in these kind of situations, and they haven't squandered their expertise in search of something else. So you have everything within you. I taught you nothing. All I did was remind you of what you already know, and I appreciate very much your indulgence and your patience with me, and I want to thank you for what you're doing, thank you for who you are, and I wish you continued success. Thank you.